Assalamualaikum and good morning to Doctor. We are from Group 6 that will present the reflective video for the Geriatric Physiotherapy Fieldwork experience using the SWOT analysis framework. And this is our group members. As an introduction, on 30 April 2026, our physiotherapy program organised a geriatric health screening event under subject NP3483 Physiotherapy Geriatric at Pusat Aktiviti Warga Emas Pawai Sungai Tua. The purpose were to promote health aging, early identification of aging health risks, and prevention of functional decline among older adults. We conducted health screening such as PAR-Q questionnaire, malnutrition questionnaire, blood pressure assessment, BMI calculation, and blood glucose assessment. For functional assessment and consultation, we did TUG, 5 times sit to stand, 10-meter walk test, and hand grip strength using dynamometer. For health promotion, we did focus on balancing and coordination games.
Now, I would like to analyze our event based on SWOT analysis. Let's get started from strength. Firstly, this event has achieved an effective application of geriatric physiotherapy knowledge in community. For example, we have conducted time up and go TUG tests to identify their fall risks and also 10-meter walk tests to assess their gait speed. This experience has strengthened our ability to connect assessment findings with clinical meaning. We learned that assessment is not only about obtaining measurement, but also interpreting the result clearly on how it affects activities of daily living and quality of life. Furthermore, this event also helped us to develop the patient communication and interpersonal skills. During the event, we learned how to explain assessment procedure in simple way and also encourage the elderly. It is because some elderly they require more time to understand and some were anxious and refused in performing the test. So all of this experience made us realize that good communication is an essential skill in geriatric physiotherapy. So we should modify our communication strategies properly to different needs according to the condition of the geriatric patients. Last but not least, this event also promotes preventive physiotherapy and healthy aging. Through the health screening activities, we were able to identify health risks early. Therefore, we can provide interventions to enhance elderly's condition. Like in the consultation booth, we educate them regarding fall prevention strategies, importance of regular exercise, and so on. So, this event has reinforced our understanding that physiotherapy is not just about providing treatment, but it do play important role in education to help the elderly to prevent the functional decline in long-term health.
Next, I will present about the weakness of our event. We observed that different stations operated at different speeds. Slower stations such as registration, BMI calculation, questionnaires require more time, which caused congestion. This resulted in uneven participant flow during peak attendance. To improve it, we should adjust station pacing by estimating average time per participant before the event. And also, we should allocate more manpower to the slower stations. The second reason of causing the station congestion is due to high demand for immediate result interpretation. This sometimes led to extended interaction at the station, even though a dedicated consultation station was available at the end. So, to improve it, we should provide a simple standard interpretation card or visual chart for quick self-understandings, and this also allows participants to review their results independently while waiting, so they can have a basic understanding before consultation. Another weakness is limited venue space. Especially during peak attendance, the indoor area became crowded, resulting in insufficient seating and waiting areas for participants. This made it more challenging to maintain a smooth participant movement between stations and also ensure a comfortable environment. So, to improve it, we should optimize station layout to create clearer walking path and reduce congestion. Utilize available outdoor space more effectively as a waiting or rest area. And also, we should provide additional sitting areas and ensure enough space for elderly participants to rest.
Now, let me introduce the opportunity part. So this experience helped us to understand the importance of preventive physiotherapy. So early health screening, we will be able to identify potential health risks before they become more serious. It reminds us that physiotherapies are not only involved in rehabilitation, but also play an important role in health promotion and disease prevention. We also recognize the value of community-based physiotherapy. Older adults can benefit from regular exercise program for prevention education and strength and balance training. In the future, we hope to contribute more community programs that promote healthy aging and help elder adults maintain their independence. Finally, This experience strengthened our professional skills, including clinical assessment, patient communication, teamwork, leadership, and problem solving. Overall, this fieldwork increased our confidence and prepared us to provide better care for elder adults in the future. That's all from me.
Moving on to our first major threat, Malaysia's rapidly aging population. As a demographic shift, we are seeing a significant rise in older adults who require structural healthcare support. For us as future professionals, the implication is clear. There will be a massive surge in demand for specialized geriatric rehabilitation service. Ultimately, this means physiotherapists must be proactively prepare themselves to manage increasing complex geriatric healthcare needs. However, meeting this demand comes with obstacles. There are several critical barriers affecting patient participation in physiotherapy. These include financial limitation, transportation difficulty, a general lack of awareness about the benefit of rehab, and a deep-seated fear of exercising due to fall risk. Consequently, this barrier drastically reduce participation in vital rehabilitation programs. Our professional role must be involved to counter this. We need to provide highly accessible education and actively promote community-based intervention to meet patients where they are. Finally, we must acknowledge the sheer complexity of geriatric condition. Managing older adults isn't straightforward. They often present with multiple chronic disease, reduced physical reserve, and complex psychosocial factors. Therefore, our final reflection is that treating this population requires far more than just physical assessment skill. It demands immense empathy, passion, and a deep understanding of each individual's unique need to truly deliver holistic care.
Overall, this geriatric health screening event was a valuable hands-on experience for us as it's enhancing our understanding of physiotherapy practice in older adult setting. We learned that geriatric physiotherapy involved more in specific outcome measure as assessment and treatment, focusing on promoting independency, preventing decline, and improve quality of life. Although we identify areas requiring improvement in our program planning and execution, this experience encouraged us to continue developing our clinical skills, communication ability, and confidence in managing the geriatric population. That's all from us. Thank you.